Hi everyone, once again welcome to my Oet channel. So today we will have one role play card and which is related to cholecystectomy, and you are the nurse sitting in hospital clinic. One patient came to you, get some more information regarding cholecystectomy surgery which he is going to have within 3 days. So first we will see the scenario. This is a hospital clinic and the setting is you see a 48-year-old patient who is going to have a cholecystectomy, that is a gallbladder removal, in 3 days, and the patient has asked to speak to you. Then the introduction will be like in a normal way. Good morning, my name is Rashmi Rajan, one of the registered nurses working in this hospital clinic. How may I address you and how can I help you today? Then patient is telling that, sister, my name is Matthews and actually I want to ask you some doubts regarding my upcoming surgery, that is a cholecystectomy. Then we can just confirm the patient. We can ask that, for my better confirmation, could you please tell me your full complete name? Then when she's telling that my name is Matthews George, then we can tell that from my system, well Matthews, I can tell you, I can see that you are scheduled for cholecystectomy surgery in 3 days, isn't it? The patient is telling that yes. Then we can tell, what is your exact concern about your surgery? Could you please explain me what is your exact doubts? Then patient is telling that I am so much nervous about the surgery and anesthesia, and our task is reassure patient about general anesthesia. That means it's a routine managed by specialist doctor or anesthetist, no need to worry, and give further information about the gallbladder operation. It's a common, usually done as keyhole surgery and short recovery, etc. So how we can present? We can tell that, Matthews, I can truly understand your concern, but no need to worry. I am here to explain you regarding the surgery and general anesthesia. First of all, I would like to tell you regarding your surgery. This gallbladder operation means it is nothing but surgical removal of your gallbladder, and it is a common procedure. Usually, we are doing it as keyhole surgery. There will not be open wound or any surgical marks. Moreover, the recovery time is very short, so there are many benefits for this surgery. Are you getting my point? Yes. Then we can go to the anesthesia. Moreover, I would like to tell you regarding the anesthesia, because you are concerned about this general anesthesia, isn't it? Actually, this is a routine surgery. I mean, the routine procedure which is managed by specialist doctor or anesthetist, and they are very specialized persons, and they are well experienced persons also. So no need to worry about your surgery under general anesthesia. So I hope it is clear for you. And the patient is telling that, yes sister, it is clear, but I have some questions regarding the operation. You can ask. Yes, sure Matthews, you can ask me, what is your next concern? Patient is telling that, what's the reason for this operation, why I have to undergo this procedure? Then we can tell that it is diagnosis of chronic cholecystitis, high likelihood of recurrence, give information about gallbladder for bile storage, not essential, liver production of bile sufficient for digestion, like that. So how we can present it? Well, I can tell you that you have diagnosed with the chronic cholecystitis. I hope you are aware about that. And if the doctor is managing you with antibiotics, there is a high chance of recurrence. Again and again, you will get the same condition. That's why doctor has planned for surgical removal of your gallbladder. But actually your concern is reasonable, because you may think that if surgically if the gallbladder is removed, means how your body will function, isn't it? But no need to worry. Actually this gallbladder, it is a storage area of bile which is produced from liver. So if this storage area, if it is not present also, there is no problem. The bile can come to the digestive system directly for the function of proper digestion process. So no need to worry about your surgery also. Is it clear for you? Are you following me? Like that we can ask. The next task is explain preoperative requirement. That means fasting from 6 hours before, removing piercings, nail varnish, shirring before operation, etc. And explain the post-operative steps also, likely same day discharge, assistance getting home. Then explore patient's post-surgery discharge plans, that is relate to your friends to escort home and stay 24 hours. So here you can see that multiple recommendations are there, multiple subtasks are there in under one task. The first thing is Well, Mr. Matthews, I would like to give you some preoperative explanations. That means it is essential for you to fast 6 hours, minimum 6 hours before the surgery, and please remove if there is any piercing, and kindly take a shower before operation. How does that sound? Then we can tell that, moreover, I would like to tell you, after the surgery, on the same day you can get a discharge if there is no more complications. And so that I am strongly recommending you to get someone for your help to go to home, because after surgery you may be weak and you need some assistance. Then we can ask, after surgery, I would like to ask you if someone is there with you, or relative or any friends, to escort home and to stay 24 hours with you. Then patient is telling that, yes sister, no problem for that, because I will come with my son so that he can take care of me in my home. I have my wife, so they will take care of me well. We can tell that, I am so much glad to hear about your family, so they are supportive also, so it is nice to hear. Then the next task is outline after effects of operation. Or else we can ask, do you have any other concern, Matthews? Then he's asking that, yes sister, I just want to ask you that after the operation, if there is any after effects. Then we can tell that your concerns are reasonable, and I can tell you that there will be, I'm sorry to tell you that there will be some effects of anesthesia, pain at incision point. Then sometimes there will be shoulder pain also due to the gas which is used to inflate the abdomen, and sometimes there will be abdominal bloating. But no need to worry, these all are temporary and very mild and can be relieved even without any medications. Are you getting my point? Then we can ask, do you have any other concerns which I need to clarify to you? Then patient is telling that, I don't have any other concerns. Then we can tell, okay Matthews, I hope I have clarified all your doubts. If you have any doubts in between before your operation, please don't hesitate to contact with us. I can give you the contact number of our hospital clinic for you. You can make a call. Okay, thank you for your visit today. So that's only the role play, and here actually this is the second role play, because we have more task and more subtask also. We have to maintain the timing. We should not explain anything more. Only one time we can just explain it. No need for any additional explanation. If you are going to give more explanation, you will lose the time, and you have to skip any of the task at the end. So always, if you see a big task, especially in the second role play, don't go for any additional explanations. Only what are the things have given, you can just it's not like a read it out, but you have to explain it in a concise manner. So that's enough actually. And always we are the one leading part, so we have to give required explanations, and in between you have to include the patient, like, are you getting me, are you following me, is it clear for you, do you have any other concern, isn't it, like that. In between you can ask. That means you are getting the patient, you are getting involvement of the patient in the role play. So in this way you can just how the role play practice. So I hope it will be helpful for you, and we will see in another one informative video. Until then, bye, take care.